This video is based on an article published by Rijo Matthew Chorkuttal, Rajasen Chaubal, Venkatesh K. Arnachalam, Neha Bagri, Anjali Gupta, Jaitner Bansal, Thara Pratap, Varsha Sadani, and Praveen K. Nirmalan in the Infographics Journal. Non-alcoholic fatty liver disease, or NAFLD, is becoming increasingly common worldwide, with prevalence rates as high as 49.8% in some regions of India. NAFLD covers a spectrum from simple fat accumulation in the liver to more severe conditions like fibrosis, cirrhosis, and even liver cancer. Traditionally, diagnosing and staging NAFLD relied on liver biopsy, which, while accurate, is invasive and uncomfortable for patients. As a result, non-invasive imaging techniques have become essential. B-mode ultrasound is widely used for initial screening due to its accessibility and safety, but it has limitations in detecting early or subtle changes and can be less reliable in obese patients. This is where advanced imaging like shear wave elastography steps in, offering a more detailed and quantitative assessment of liver health. Shear wave elastography, or SWE, is a cutting-edge ultrasound technique that measures the stiffness of liver tissue. By generating and tracking the speed of shear waves through the liver, SWE provides both qualitative and quantitative data about tissue elasticity. This is important because changes in tissue stiffness often occur before structural changes become visible, allowing for earlier detection of liver disease. The process involves using a high-resolution probe and specific patient positioning, such as the left lateral position, to optimize image quality. The probe sends out pulses, creating shear waves, and the resulting data is displayed as a color-coded map overlaying the standard ultrasound image. These colors correspond to different stiffness values, helping clinicians assess the degree of fibrosis or other liver changes. SWE is less operator-dependent and offers better depth penetration than traditional methods, making it a valuable tool in the clinical setting. Forming a shear wave elastography assessment for NAFLD involves several key steps to ensure accurate and reliable results. First, patients should fast for at least 4 hours before the test, as eating can temporarily increase liver stiffness. The clinician uses a linear high-resolution probe to scan the liver, looking for irregularities and selecting the best area for measurement. The patient is positioned to maximize the intercostal space, usually lying on their left side with the right arm raised. The probe is placed perpendicular to the liver capsule, and the region of interest is carefully chosen to avoid blood vessels and artifacts. Multiple high-quality images are captured, and the median value of at least 5 measurements is used for interpretation. Quality indicators, such as motion stability and reliability indices, help ensure that only the best data is analyzed. These practical steps help clinicians stage NAFLD accurately and guide further management. Interpreting the results of shear wave elastography involves understanding the liver stiffness values and their clinical significance. The rule of 4 is commonly used. Values below 5 kPa indicate a high probability of a normal liver, while values above 13 kPa suggest advanced chronic liver disease. Intermediate values may require further testing or follow-up. SWE also helps identify cases of clinically significant portal hypertension when values exceed 17 kPa. It's important to consider potential confounders, such as recent meals, inflammation, or technical artifacts, which can affect measurements. By following standardized protocols and using vendor-specific quality indicators, clinicians can minimize errors and make informed decisions about patient care. SWE is a promising first-line tool for NAFLD screening, offering a non-invasive, accessible, and reliable way to monitor liver health and guide further diagnostic or therapeutic steps.